episode of Down with Daughtry, where I have the pleasure of interviewing Miss Megan Mercer and Miss Jennifer Dre. They both are with the Institute of Health Logistics and Analytics with Georgia Southern University. Welcome, ladies.
Thank you. Thanks for having us.
Yes, and look, I have bios, so I must introduce them properly, okay? Megan Mercer received her Bachelor of Arts from the University of New Hampshire in 2009 and a Master of Public Health from Georgia Southern University Armstrong campus in 2015. Megan has many years of experience working in the community, advocating for children and adult survivors of violence, as well as developing, facilitating, and evaluating violence prevention programs. In 2023, she received her certification as a health education specialist, and she started with the Institute of Health Logistics and Analytics in June of 2024 as Community Relations and Event Coordinator. She has a passion for building relationships, creating sustainable collaborations with community partners, and working to achieve health equity among underserved communities. And Meg and I actually have a past working relationship as well, so welcome, Meg.
Thank you. It's good to be here.
Yes. And Miss Jennifer Dre, glad to have you here.
Thank you.
She is also a public health professional who's focused on interventions that reduces common barriers to wellness, particularly in underserved communities. She currently serves as Community Outreach Coordinator at the Institute for Health Logistics and Analytics, where she focuses on building relationships and promoting project participation. Her current projects in this role include information gathering for the Community Health Resource Project and serving as lead for the Health Kiosk in Rural Georgia project. Her past work with IHLA includes the implementation of federally funded COVID-19 mitigation programming in Georgia schools and confinement facilities. Jennifer holds a Master of Public Health and Prevention Science from Emory University and a BA in Journalism from University of Maryland. Welcome, Jennifer.
Thank you so much.
And a little unknown fact that you both do not know about me is I have a bachelor's degree in public health.
You do?
I
didn't know that.
Yes.
That's awesome.
Kind of how our roles just kind of cross, right? And these
Yeah.
kind of helping services, these programs that we do. And you ladies are here so we can learn more about the Community Health Resource Project.
Yes.
We are so excited. We know that this project is something that is needed. So we'll just jump right on in. And can you tell us what is the Community Health Resource Project?
Yeah, so the Community Health Resource Project is a 2-year program where we are highlighting resources in rural areas in Georgia. And so we will be in 18 counties after this year concludes. And so it's a strengths-based approach. So we are really seeing at what the rural areas are already doing in terms of health services and resources. And so we're looking at that, we're highlighting them. We will create interactive maps for each county, and we'll also create county-specific reports with the assets as well as insights that we've learned about the community.
Well, that seems like definitely it will be a resource to each county that you speak of. You said 18 counties. So what are the specific areas that are the focus of this project?
Yeah, well, I think one thing that kind of oversees everything is the area of One Health, which One Health means that it recognizes kind of the intertwined nature of human, animal, plant, and environmental health. So that's sort of an overarching theme area or guiding area. But within that, when we start talking to people looking for health assets in communities, we're really looking at everything. I always tell people it is traditional healthcare because that's usually easier to find, your hospital and your primary care. But it's also non-traditional healthcare. It's green spaces. It's
Childcare.
right.
It is
Employment services.
vet services.
Right, because of that One Health approach. So we'll talk to like the UGA extensions if they're in those communities. Healthy cooking. so many things touch health that I think it really does get very broad
Yes.
in what we're defining as a health asset.
Yeah, it really is like anything that makes a community healthy, and that really is everything
Yeah,
about that community. So it is, as Jen said, very broad, but
Well, I think that broadness definitely is what sets this project apart from other, resources that we have. We have a lot of websites that say, okay, this is where you can go one click, but this broadness, I think, definitely sets it apart because wellness is just not about your health. It encompasses, like you said, everything, your environment and your animal's health, right?
Mhm.
So I love
Exactly.
that. I love that about this project. So it seems pretty extensive. So how many members are involved on this project?
yeah, so we have a lot of team members doing kind of different things related to this project. So Jennifer and myself are in the communities. We also have another community outreach coordinator, and the project is led by Dr. Tanya Jules. And so we're in the community talking to people, getting information, but there are also people like behind the scenes doing a lot of work to make sure the asset maps run correctly and are updated, working on marketing, working on our conference materials, working on like everything that's given out to the community. So we have a lot of team members kind of doing different things, but mainly the ones out in the community, there's about 4 of us.
Right. Wow, so you have a lot of ground to cover, needless to say, right?
We do.
Yes, yeah.
And and I heard you mention earlier about strength-based approach. So can you tell us what is a strength-based approach and why does this project use it?
Yeah. So strength-based approach is kind of the, I guess, I don't want to say opposite, but the other side of like, you hear a lot about a community needs assessment, and what those do, and they're great and they're needed in a lot of areas, is they kind of look at a community and see where some of the gaps in services are and some of the holes. We look at the community from what is there, and so what are the strengths. And the reason that we do that, the reason why we take that approach is really because, our feeling is we can't fix what's not there. That's not something we're in the position to do, so we don't need to tell people what's not there. But instead, if we're kind of looking at what is there and sometimes thinking about it from a different approach, maybe an outsider approach, or working with the community to look at it from their view, we can kind of think about what can you build on, because if you have strengths in a community, the best place to start adding the things that you don't have is really from the things you do have. So that's what the strength-based approach looks to do, is start with the strongest points in the community and think about how they could be even stronger.
Yeah, definitely like that perspective because like you said, if you focus on what you don't have, sometimes that can get a little depressing. Like we don't have anything here, but if you focus on what you do have, then it's like, yeah, the perspective kind of shifts. We do have a lot of resources in our community, and if we are lacking, maybe we can now identify them and pull resources for that. So I like that. I really, really do. So tell me, when will it be completed and ready for the community?
So it is an ongoing project. It will be completed at the end of 2025 with 18 counties being covered. But we are in each county for about 50 or so days. And as we finish each county, we start working immediately on creating that asset map and creating those reports for the county members, community members. So it is ongoing. But the entire project will be done at the end of 2025.
Well, that's interesting. That's because as you're saying, as you go finish the county then gets access to those resources that they have. So it's just immediate for them, and then you just kind of wait. I like that. Kind of roll out as you go.
Yes, exactly.
Absolutely.
Okay. So we don't have to wait till the end of 2025 to know. So how can the community assist you all in development of this project?
Engage with us, talk to us, reach out to us.
Yeah.
I think that one of the things that we're really trying to do is we know the things that are online, but we don't know the things that are more kind of under the radar in a lot of these communities, and a lot of things seem to be happening. I know from my experience, it seems that, sometimes just a person in a community is a big resource, or, something that's occurring with really no online presence. And those are the things that we really need the community to help point us to and talk to us. And we always are asking people, who should we talk to next, and all of that. And so really keep in mind, I think, that that's what we're looking for, is truly those hidden kind of gems in the community that we can help other people find.
Yeah, and we know, like, we are coming from an outside perspective. We know that the community members are the experts in their own community and how things work and how people access resources. So we are really learning and listening from the community members. And so this project doesn't work without input and engagement. And so even if we are not in a specific county, so if we have finished, so we're in Screven, Jenkins, and Wayne right now, but we will be moving on to different counties in a few weeks. But even if we're not in the counties anymore, you can still go on our website, you can still fill out the survey. We still want to hear from you about the resources in your community and try to get a really accurate representation of what's going on and how everyone is just using those strengths in their communities to be healthy.
Yeah, absolutely. And we will put the link to the survey in our comments, and also the link to the web address that will provide more information on the CHIRP project, which is, again, the Community Health Resource Project. So tell me, is there anything else you'd like to share with us about the project that I haven't already asked?
Well, I do think it's important to mention, so what we've talked about today is what we do in the day-to-day all the time as community outreach coordinators, going out in the community and speaking with people and building out these asset maps. But there is another side to the project, which is once we've identified all of these strengths in the community, we do work on the back end on a workforce development report that goes out to each county as well, and any community stakeholders in that county that want to see it. It really focuses then on those strengths and our recommendations for how those strengths could really be built upon and support workforce development, how workforce development could support strengthening those community assets. And so that's another really important piece of what we're doing that comes a little bit later than the asset maps that go out pretty quickly to the communities.
Yeah, and we are funded by the generous donation from the Centene Foundation.
Wonderful. Yeah, I'm sure funding is always critical for these types of projects, so I'm glad that y'all were able to receive that. And the workforce development piece of it, again, you don't think about that affecting the health of the community, but it definitely does play a big part of it. So
Absolutely.
yes, thank y'all for sharing that with me as well. I have thoroughly enjoyed learning more about this with you two ladies. Thank y'all for coming. But before we end, I'm gonna ask you two rapid fire questions, okay? Just kind of a little fun thing at the end of Dawn with Daughtry. So, cat or dog?
Cat.
Okay, what about you?
Dog, unless we're talking about my cat.
Oh, okay. I can understand. I got you there.
I have a great cat, but the other cat, more dogs over all the other cats.
Okay, interesting. Hey, I understand. I'm with you, Jen.
Sorry, other cats.
Love all animals.
That's right.
Yeah, all animals. One health.
Love them.
Love
yeah.
the animals.
All of them. So, favorite subject in school?
It was chorus.
Which does not surprise
Right.
coworkers, I'm sure.
Yes.
She's a little songbird, huh?
She's a singer.
Yes.
What about you?
I'm gonna say English.
Okay.
My first love was writing.
Yeah.
So first career love was writing, and so I did always enjoy that even as a kid.
Wonderful. Hence the journalism degree, right? Yeah, that's cool.
And I can't sing, so I really hated chorus.
I don't know how they let me in the chorus, but I was there. I still don't understand to this day, but hey, it was a great experience.
Yeah.
I am
about
not.
just having fun.
Yeah, I wish
Yes.
it was chorus.
Well, again, I want to thank you, Miss Jennifer Dry and Miss Megan Mercer, for having taken the time out of your day to sit with us and talk with us about this wonderful project that y'all are working on. I can't wait to see the end results because, as I failed to mention, we do here at Child Advocacy Services, we cover Scriven, Jenkins, Bullock, and Effingham, which are all included in the CHIRP project.
Scriven and Jenkins are included
Okay.
in that project, yes.
Okay.
And then we will be expanding out to further other rural counties.
Wonderful.
Going forward,
Yes. Well, we look forward to it, and whenever you need us, we'll be here for you, ladies. Okay.
Thank you so much.
Thank you so
Thank you for
much.
having us.
Alrighty. Thank you for watching.
Bye.
Bye.